as if you gave them 1, it would be enough. If you gave them 1.2, that would be enough. But if you gave a cancer, if 0.8 to 1 gram of protein is normal, most cancer patients aren't going to need 1 gram per kilogram. You get what I'm saying? So even though you're giving me a range, if your range starts off with 1, that's usually less than what most cancer patients need. Okay? So when you give me a range, the lower end and the higher end should both be acceptable for that patient. Make sense? Okay, but don't spend too much time on it. The idea, the range that I have in my head is a large range, so I give you a lot of leeway, okay? The other thing you'll see in the case study is it says to explain why you gave them the range you did. Explaining why doesn't mean because in the PowerPoint it said that cancer patients get 1 to 1.5 grams per kilogram. That's not explaining it, okay? When I say explain, I want you to tell me what are the patient's stressors? Like, why do you think this patient's needs are increased, or why do you think they're low? Okay, so tell me what their stressors are when you explain it or give me the rationale. Okay. So make sure that you know the calorie and protein needs for cancer. Okay, and these are just interventions, and a lot of them we've talked about along the way, but the diarrhea, kind of what you would do for a child, drinking fluid throughout the day, maybe giving some oral rehydration fluids so that their electrolytes are not off. If someone has anorexia, do you know there are medications that are called appetite stimulants? We can give those to patients. They don't always work. Several of them, usually within a day or two, you'll know if they're beneficial, but they're not always the most effective. Nausea and vomiting, we usually determine what's causing it, so then we'll try to treat it from there, or we'll do some of the hints like open up the tray outside the room, don't eat your favorite food when you start chemo. Some of those things will kind of help with that. Early satiety to small frequent meals, and this says that are nutrient dense. So this goes to your point, Jacqueline. We want to make sure that they're nutrient dense foods as much as possible. Mucositis, which is the oral irritation. Sometimes with that they can't eat or chew, so it's easier to drink. So we may do the high calorie, high protein beverages. And then the xerostomia, the enhancing saliva production, and we talked about ways that you can do that. Nutrition support we're going to touch on later, but there's one thing I want you to just kind of note. Whenever thinking about nutrition support, we have to outweigh the risk and benefits of it, and we also want to decide if this is beneficial for the patient. When we look at things like parenteral nutrition, which is PPN, and it goes directly into the patient's veins. So when you have patients that are immunocompromised, if you think about placing something into their veins, you increase their risk of infection. So we want to make sure before we place something like parenteral nutrition that it's actually beneficial for the patient. Okay? So we want to think about those things. Yes, we want to get nutrients in them, but we don't want to cause them any more problems if they're already immunocompromised. When we think about nutrition support like enteral nutrition, which utilizes the GI tract, we just want to make sure of the patient's wants and needs. Sometimes patients, we have to honor their end-of-life decisions or their end-of-life choices. So we kind of want to look at all of those factors when we're initiating nutrition support. We want to look at what the patient wants and what's going to be most beneficial for the patient. This just kind of goes over that. We talked about sometimes that feeding tube is placed prior, and we talked about this like with head and neck cancer. We go ahead and we place the tube right away just before starting therapy because we know those patients are going to need it. With parenteral nutrition, just making sure that we consider the ethical considerations. Is this really helping the patient? You know, what state are they in? Look at the risk and benefits. This is the risk of infection.